Welcome to a special edition of Medicine Meadville. I'm Dwayne Kohler from Meadville Medical Center, and we are talking about medication safety today. Our presenter will be Bev Kennedy from the Pharmacy Department at Meadville Medical Center, and she's going to go over a bunch of topics, and then we'll have some questions for her. But medication safety is an important topic, and everyone should pay attention, so stay tuned.
Hi, my name is Bev Kennedy, and I'm a pharmacist here at Meadville Medical Center. I'm here today to talk to you about medication safety. The material that I'm using today is from an organization called Medication Use Safety Training, and it's a program developed by the National Council on Patient Information and Education. So I want to acknowledge that the National Council on Patient Information and Education, with help from the Peter Lamy Center for Drug Therapy and Aging at the University of Maryland School of Pharmacy in Baltimore, helped me with this material. As I go through the presentation, I want you to think carefully about how you use medicines and how the people you care for are using medicines. Then think about the steps you can take to make sure that whenever you take medicines, you are taking them correctly and safely. Let's consider this question. How many of you have ever taken a medicine? Probably almost everyone, whether a prescription or an over-the-counter medication. How many people have had a problem with a medication? Research estimates that 37% have experienced at least one medication-related problem. 1 in 3 people. Are you that one person? Today we will be learning ways to identify problems related to using medicines and the tools and techniques we have to make medication use safer. So what is a medicine? Medicines can change the lives of people with illness or diseases. Medicines are just one aspect of treating a disease or a symptom. A good attitude and a belief in treatments, including medications, help to improve a patient's general well-being. When used correctly, medicines can lead to a better quality of life, a healthier life, and a longer life. Some fast facts. Older adults comprise 13% of the population today, but 34% of all prescription medication use and 30% of all over-the-counter medications are used by older adults. 4 out of 5 older adults live with one or more chronic conditions. Many older adults may take multiple medications at the same time. A survey of 17,000 Medicare beneficiaries found that 2 out of 5 patients reported that they took more than 5 medications at a time. The definition of an older adult is someone who is considered over the age of 65. Another fast fact is that older adults are at increased risk of serious adverse drug events, which may cause illness, hospitalization, and death. Examples can be falls, depression, confusion, hallucinations, and malnutrition. Another fast fact is that drug-related complications have been attributed to many factors: polypharmacy, drug interactions, age-related changes, human error, poor medical management, such as incorrect medicines are prescribed, inappropriate doses, lack of communication and monitoring, and then we have patient compliance issues. Another fast fact is almost 40% of seniors are unable to read the prescription label, and these are due to a multiple of problems: visual acuity, complicated terms on the label, abbreviations on the label that are not understood. About 67% are unable to understand the information given to them. The big thing to remember is to ask questions. Ask your pharmacist, ask your physician, they're more than happy to answer questions. One of the things people realize they forget to turn the lights on. If you're going into the kitchen to take your medications, turn the lights on. Read the label. If you can't, let your pharmacist know or your healthcare team know. Sometimes we can use different fonts, different types, so that it can be changed so it's easier for people to see. Other things can be done like color coding the caps or to writing on the caps. Also, medication boxes can be filled. We can help out with filling medication boxes. But the important thing is to ask. Sorry about that. The different types of medications, the prescription medications are the medications that your healthcare provider prescribes for you. They might be blood pressure medications, blood thinners, antibiotics, or eye drops. Over-the-counter medications are non-prescription medications. These are things that you buy out, not, we call them over-the-counter because you can buy them in pretty much any stores. Those are the aspirin, the acetaminophen, cough medicine, and then the different combinations. There are similarities as well as differences between prescriptions and over-the-counters. Prescriptions are ordered or prescribed by the licensed healthcare professional and are purchased at the pharmacy. You can get prescriptions from a drugstore or a pharmacy in a retail store, or you can get them through the mail by a mail order, or actually you can now place orders online by placing an order on the internet. Over-the-counter medications, and I already went through this, and this is just another way, are found in drugstores, supermarkets, and discount stores. You do not need that prescription to buy them. It can be very convenient to just go and buy whatever medication you need when you need it. But this means that you are in charge of picking the right medicine, taking the right dose at the right time, and watching for side effects. Drug interactions can happen with over-the-counter medications and with prescriptions. You need to be, all medicines need to be reviewed regularly by your healthcare team, your doctor, your pharmacist, your physician assistant, or your nurse practitioner. Dietary supplements and herbal medications do not have the same rules as prescription medications. Manufacturers, not the FDA, are responsible for determining that the dietary supplements they make are safe. These supplements do not need approval from the FDA before you can buy them and take them. There is a variability of dietary supplements among manufacturers. If an herbal or dietary supplement has the letters USP on them, on the label, then the tablets and capsules are determined to have the same amount of the ingredients in each tablet or capsule. So it's important to watch for USP to be on the label of your herbal or dietary supplement that you take. The prescription drugs must be proven safe and effective for their intended use before marketing. No provisions in the law for the FDA to approve dietary supplements for safety or effectiveness before they reach the consumer. When a medicine's benefits outweigh its known risks, the FDA considers it safe enough to approve. But before you use any medicine, you should think through the benefits and the risks so that you can make the best choice for you. There are several types of risks from medicine you might use. First, there is the possibility of a harmful interaction between the medicine and a food, beverage, dietary supplement, including vitamins and herbals, or another medicine. If you combine any of these products, you increase the chance that there could be interactions. Second, there is a chance that the medicine may not work as expected. And third, there is the possibility that the medicine may cause additional problems. When you are trying to weigh the benefits and risks of taking a medicine, you may face a difficult choice. The best choice always depends on your particular situation, and in many situations, the expert advice of your healthcare professional can help you make the decision that is best for you. Here's a question to consider. What types of problems have you heard of that were caused by medicines? Maybe an allergic reaction or a side effect, such as a headache or an upset stomach. Here are some specific ways to lower the risks and obtain the full benefits of medicines. First, talk with your doctor, pharmacist, or other healthcare professional. Know your medicines, both prescription and over-the-counter. Read the labels and follow directions. Avoid interactions. Monitor your medicine's effects and the effects of other products that you use. Some bad things can happen to you as a result of taking only one medicine or several medicines. Some examples of medication use problems can include a stomach ache from an antibiotic, or being a little dizzy when you stand up because you forgot to take your blood pressure medicine yesterday and you took 2 tablets today. Some more serious side effects can include a bleeding stomach ulcer caused by too much aspirin, or fainting due to low blood sugar because you took your diabetes medicine and then you didn't eat. Overuse of medicines can happen by accident. Perhaps you can't remember if you took a medicine in the morning, so you take it again in the afternoon. Overuse can also happen on purpose. For instance, you take an extra pain pill because you're going out for a walk. Underuse can be as big a problem as overuse, and can also happen by mistake or on purpose. You may forget to take your evening dose of an antibiotic because you fall asleep, or you may deliberately decide not to take your diuretic or your water pill because you are going shopping and you don't want to have to run to the bathroom during your trip. Taking less medicine than prescribed, or none at all, happens a lot. Sometimes people forget. Sometimes they are confused by the directions, or may simply decide that they don't need it anymore. Taking medicines that are not prescribed for you can also cause problems. Drug interactions occur when a medicine you are taking reacts with another medicine you have taken, or food that you have eaten, or liquids that you have ingested, particularly alcohol. Drug interactions can cause increased or decreased amounts of medication in your body and lead to side effects or a less effective therapy. Here's something else to think about. When can medication problems happen? The answer, lots of times. As you can see on the slide, some things make it more likely that a problem might occur. As another example, suppose you are taking 3 medicines regularly, and your doctor prescribes another medication which has to be taken 3 times every day. Suddenly, your medication taking schedule has to be adjusted to include those medicines that you're already taking, plus the new prescription that was just added to your regimen. There are ways you can help avoid medication use problems. One of the most important things you can do is learn about your medicines and health conditions. You can do this by talking to your healthcare providers and reading all the information that comes with your medicines. You can also use the drug facts label found on the packaging or containers of over-the-counter medicines. Keep an updated medication list to share with your healthcare providers at each visit. Ask your pharmacist about your medicines until you thoroughly understand your medication instructions. When in doubt, always ask. Here's some questions. Do you know your medicines? Do you know what your medication is used for? Is this a brand or a generic? Where should I store it? How should I take it? How much should I take? How often or what time of day should I take this medication? With or without food, should you take it with or without food, or with or without other medicines? What should you expect to do? How would you be able to tell if the medicine is working? What are the possible side effects and what to do about those? Is there testing or monitoring needed with your medication? And what should you do if you miss a dose? Do you know the answer to these questions about each medication you take? If you don't know the answer, check with your doctor, prescriber, or nurse or pharmacist. So let's take a close look at the questions on this slide. You have to know the information about each medicine you take. What is the name of the medication? What is it supposed to do? How do I take this medicine? Does it matter what time of day I take this medicine or whether I take it with food? Some medicines have to be taken on an empty stomach. Other medications require food for the absorption of the medication into your system. How will it interact with other prescription medication or over-the-counter medicines I am taking? Sometimes different medications together can cause more problems. The best way to ensure safe medication use is to be knowledgeable about everything you take. More questions that you need to know about your medication. Is there anything that you should not take, eat, or drink while you're taking it? Should you avoid alcohol completely, or is like one drink here and there okay? Those are questions you need to ask if you don't know the answers. How do you keep track of all your medications? Do you use a pill box for your doses? Do you fill it every week? Should you store the medication? Sometimes medications need to be stored in the refrigerator. Some medications need to be stored in a dry, cool place. Keeping medication in the medication cabinet in the bathroom is not a good idea. The heat and humidity from the bathroom is not a good place for your medications. Other questions that goes with about your medication: is it always okay to break your pills in half or crush them and put them in food if you can't swallow pills? And by crushing them and putting them in food, it makes it easier to swallow. Not every medication can be broken in half or crushed or put with food. And is a household teaspoon okay to measure my child's medication? Every teaspoon, the household teaspoon that you have in your silverware drawer, is not the same measurement. 5 mLs equals 1 teaspoon, and it's best to use the medication, the teaspoon, the measuring teaspoon that comes with the medication, or not using your household teaspoon. Your up-to-date medication list is one of the most important things you can have to protect your health and avoid a medication use problem. Keeping a current medication list can help improve medication safety by first helping to avoid duplication of similar medications. Second, it can help your healthcare team members spot and stop possible drug interactions and drug duplications. And third, letting all the members of your healthcare team know about all of your medicines will help them make more informed decisions about your treatment. Your medication list can literally save your life in an emergency where you cannot speak for yourself. Because they do not always talk with each other, it's important that you communicate your medication list with everyone. When making your medication list, be sure to add any new medicines that you start and to cross out any medications you no longer take. And that's all I have for you today. If you have questions, ask your pharmacist. That's the best thing I can say. And my references, I use most of the website, Must for Seniors. And Must is a national education campaign designed to promote safety and appropriate medication use.
Let me ask you a couple. What about expired meds, or I finished that one and I still have some left over. Pain med, I might have a headache later on, so I'm going to save that. Talk about that for a second.
Okay, the pain medications, if you really should not save pain medications for use. They should be only used at the time that they are appropriate for the pain. Using them later on for a headache may not be appropriate, and side effects you may notice more side effects, or you might have a fall, or other problems might happen.
What about expired ones and disposing of safer?
Expired medications that are not controlled substances can be disposed of in different spots. Like I know our Crawford County Courthouse has a drop box. Outside our emergency room entrance, there's a drop box to use to drop off unused medications. It's if your doctor tells you to stop taking a medication, the best thing to do is to get rid of that medication. Don't keep it in your house for a later time. I know sometimes it costs money and so forth, but it's not the safe thing to do, especially if you have children in the household. If you have bottles laying around that are have medication in them that you're not using, you may not think of it, but children go wandering and looking, and it's just not a safe thing. So use those receptacles that are either in the courthouse in Meadville, or in the emergency room entrance, at the entrance to the emergency room here at Meadville Medical Center, to get rid of those unused medications.
So if you have a multiple medications that have to be a certain time, and one with food, one with dinner, and one before bed, is a pill box that lines them up, by the time of day or whatever?
A pill box is like the best thing to help remind people to take the medication at the right time. And I like recommending a pill box because if it's a couple hours later than you normally take the medication and you have a pill box, you can go to that day and that time period and you can open it, and if there's a pill in there, you didn't take it. If there's nothing in there, then you can pretty much assume that you did take it when you were supposed to take it. So I like the pill box with the morning, noon, evening, and bedtime for people, especially when they're taking more than one medication at one time a day. And it just helps people to know and take their medications appropriately.
Does it make sense to take that to the pharmacy and have them help you set it up?
Some pharmacies will help you set that up. Sometimes it's a family member needs to come and help you set up. I would put the bottles that you get from the pharmacy in a line and then fill one bottle at a time for the entire week. I would do it systematically so that one medication is open at one time, so that there's no mix-ups and so forth.
Back to that same point, does it make sense to continue to work with one pharmacy so they would be aware of all the medicines and not have those timing issues, or maybe medication fighting with each other issues and that kind of stuff?
Today, most of the pharmacies are connected by computers within the insurance company. So the filling of prescriptions they're interconnected, and it is best to stay with one pharmacy, one pharmacist that you deal with that knows you, because they know you, you know them, and that's the best relationship, and the trust is there, so that if there's any problems with your pills looking differently, it is important that you stop and ask. Always don't be afraid to ask questions about your medications.
Every time I see a medication ad on television, tell your doctor you had this ailment. Tell you, how come your doctor doesn't already know that? That's probably the other side of that same question I just asked you.
Well, the TV ads today are geared for you to go to your physician and ask about, and it started with ask your doctor about the purple pill. So a lot of today, healthcare is driven by the patient. And I think that, if you see an ad on the paper and you want to ask your physician about it, there's still more to the story than just because you saw it on TV, that means that it should be the best medication for you. Not every medication is right for every person.
Another extension to that same question. Internet's got information out there all over the place. Can I trust what I find whenever I look something up about a medication or about a safety issue with medication?
The internet is not always correct. I've been trying to tell my 8-year-old grandson that you can't trust everything on the internet. Stick with websites that are connected to major medical universities, like the Mayo Clinic has a nice website, and they have a search and you can ask questions. I know like John Hopkins down in Baltimore has a good, stick with the CDC website and for your information about your medications, or the manufacturer of that medication is trying to sell that medication. So the website for that drug is not always the best material. It's biased, so they want to sell you that drug. So be aware of that. Go to the CDC website, go to the large university web sites like the Mayo Clinic, the John Hopkins.
So if we're down the road, is there like a take-home point you would leave folks with for this whole?
My whole take-home point is don't be afraid to ask. Ask questions. Pharmacists love answering questions. We're better at answering questions than we are presenting different things. So don't be afraid to ask questions. They always seem so busy, I know, but they don't mind stopping and answering questions. That's what we like to do, and pharmacists are the medication experts, and we love answering questions about medications.
Well, thanks, Bev. That was great. We certainly appreciate all the thoughts you had there. And just my own reflection on that is have a relationship with your doctor, have a relationship with a pharmacist, and talk that stuff over. Don't hold back. There's time to be careful, but that's not one when you're talking about the medication and being safe. Okay, thanks for joining us today on Medicine Meadville, and we'll talk to you next time.